HEDIS and star ratings. Star ratings are comprised of a particular set of HEDIS measures. Surveys, such as the Health Outcome Surveys and the Consumer Assessment for Healthcare Providers and Systems, or CAPS, and also Part D measures. Star ratings for Medicare Advantage plans are on a scale of from 1 to 5, with a star rating of 5 being the highest attainable rating, and that indicates excellent performance. Medicare Advantage plans with a 5-star rating are able to enroll beneficiaries all year round. BMI. This is a measure that really requires documentation review. It's done on people 18 to 74 years of age as of 12/31 of the current year. The documentation must be present in the current year or the prior year on an outpatient visit. V codes, V85.0 through V85.5, are submitted, and for patients younger than 19, documentation of BMI percentile, documented as a value such as the 85th percentile, are plotted on an age growth chart, also meet criteria. Exclusions for the measure are pregnancy during the current year or the year prior. Really have to review those medical records for height, weight, and BMI as specified above. Breast cancer screening is obviously for females ages 52 to 74 as of 12/31 of the current year. The mammogram must have been performed anytime on or between October 1st, 2 years prior to the current year, up to 12/31 of the current year. It's captured by insurance claims with CPT, HCPCS, ICD-9, and mammogram codes most of the time. Exclusions include patients with a history of bilateral mastectomy or 2 unilateral mastectomies. You have to review the medical record for mammogram reports on females starting at age 50 to 74 as specified above. As of 12/31 of the measurement year, for both genders ages 67 and older, there must be an eye exam for glaucoma performed by an optometrist or ophthalmologist in the current year or the year prior. Exclusions to the measure includes those patients with a prior diagnosis of glaucoma or a glaucoma suspect. Review the medical record for eye exam reports on any patient 65 and older without a diagnosis of glaucoma or glaucoma suspect. It's usually captured by the health plan by CPT and HCPCS codes submitted by the optometrist or ophthalmologist, but really the PCP should be redocumenting and resubmitting. Care of the older adult pain assessment. See, pain assessment has to be in the current year, and the date it was performed must be documented in the medical record. Documentation must include that the patient was assessed for pain, positive or negative findings, or a result of an assessment using a standardized pain assessment tool. Submit an 1125F if pain is present, and 1126F if pain is not present. Choose whichever pain assessment tool you like. Obviously, the numeric scale, verbal or written, is the easiest, but it needs to be done. All-cause readmissions, or as I call it, any-cause readmission. Patients 18 years and older who were readmitted for any diagnosis within 30 days of an acute inpatient stay, they fall into this category. A lower rate indicates better performance, obviously. PCPs and hospitalists must be aware of readmissions and have measures in place to prevent readmissions. Practices should receive information from both the hospitals and the MA plans on admits, discharges, and ER admits.